What comes to your mind when I describe symptoms such as feeling short of breath, dizziness, or having a tightness in your chest? While typing these into Google, you will most likely get multiple suggestions, such as possible heart problems or anxiety. You will then navigate your way through the sources Google is showing you, opening link after link, and most likely get lots of answers. By this point, you might access online health forums, have already made the decision to contact a healthcare professional, or feel satisfied with the answer that you retrieved from Google. Having access to so much information online can be held to our advantage, but when we don't know how to navigate that information, that's when it can lead to many issues, such as becoming misinformed. My PhD looks at the effects of online self-diagnosis and health information seeking, and the impact it has on the patient and healthcare professional relationship. It also has a specific focus looking at online heart failure diagnostic advice. I completed a mixed method systematic review, conducted 2 exploratory studies analysing heart failure online health forums, and conducted 31 interviews with public participants and healthcare professionals. So what did I find? The most common type of information people sought from online was those looking for support on their new diagnosis or conditions. The most common question people asked was to understand what their symptoms were. So for example, heart issues or anxiety. And that usually led to the question, is it my head or my heart? The most common time people accessed online health forums was after a healthcare appointment. From analysing the forums, we realised why. Between 40 to 80% of medical information provided by healthcare professionals is forgotten immediately. The greater amount of information presented to the patient, the lower opportunity it is to be correctly interpreted. So when they have a waiting time between their initial diagnosis and a follow-up appointment, it can increase the opportunity for misinformation, and especially when they're navigating the online information for the first time. Many people resorted to online health forums because there were information gaps. They received a diagnosis, but they wanted to find out how it's going to impact their lives, what happens next, and more explanation of what their results mean. My PhD looks to improve these information gaps, to provide resources and support for healthcare professionals to help better navigate their patients to reliable sources, and to reduce the amount of misinformation spreading on the internet. Online misinformation has been an increasing issue which has been significantly highlighted during this global pandemic, but it's an important problem that my PhD has been addressing since before and will continue to do so. Thank you.